How do different skin biopsy types affect surgical margins? When it comes to skin biopsies, the type chosen can significantly impact the assessment of surgical margins in skin cancer treatment. Let's break down how different biopsy methods influence this important aspect of diagnosis and management. First, we have the excisional biopsy. This method involves removing the entire lesion along with a margin of normal tissue. Because it captures the whole lesion, it provides the most complete information about tumor margins. This is crucial for determining if any cancer cells remains at the edges of the removed tissue. For example, low-risk basal cell carcinoma typically requires surgical margins of 3 to 5 millimeters, while high-risk cases may need margins of 5 to 10 millimeters or more. Next is the incisional biopsy, which only removes a portion of the lesion. This approach is often used for larger lesions or those in sensitive areas. While it provides diagnostic tissue, it does not allow for a complete assessment of the tumor margins. As a result, if further surgery is needed, wider margins must be considered to ensure complete excision. The punch biopsy is another option. It removes a cylindrical core of tissue, usually 2 to 6 millimeters in diameter. While it is primarily diagnostic, it does not provide complete margin information. After a punch biopsy, surgical planning often requires wider excision margins to account for the partial sampling of the lesion. Then we have the shave biopsy. This method removes a superficial slice of the lesion and may not include the full thickness of the skin. This limitation makes it less reliable for assessing deep margins, especially in invasive cancers. Shave biopsies are often used for diagnosing or treating superficial lesions, but may not give a clear picture of the margins. Lastly, there is curettage, which involves scraping off tissue with a curette. This method is generally more of a treatment than a diagnostic biopsy and does not provide useful margin information. It is not suitable for assessing margins in skin cancer surgery. The type of biopsy performed directly affects the surgeon's ability to determine if cancer cells extend to the edges of the removed tissue. Excisional biopsies provide the clearest margin status, allowing for more precise surgical planning. In contrast, incisional, punch, and shave biopsies offer limited margin information, often necessitating wider surgical margins during definitive excision. For high-risk or aggressive skin cancers, Mohs micrographic surgery is often preferred. This technique allows for complete margin assessment while preserving healthy tissue, especially when initial biopsy types do not provide clear margin status. In summary, the choice of biopsy type plays a crucial role in surgical margin decisions. Excisional biopsies offer the most accurate margin assessment, while partial biopsies requiring more cautious surgical margins to ensure complete tumor removal. Understanding these differences helps clinicians balance effective cancer treatment with the preservation of healthy skin and function. Always consult with a healthcare professional for personalized advice regarding skin biopsies and cancer management.